agreed to pay $17 million for their fraudulent billing of Medicare. They came here and slept in undercover, and I don't know how much was on the part of the city and how much was on the part of the company itself. That I do not know. I cannot speak to it. I do know that facilities such as this, if they do not have counseling services with the drugs they furnish, it has a very low success rate. There's a Boys and Girls Club just down the street. You can throw a softball that far. There's a baseball diamond where kids play all the time. We believe there needs to be a treatment facility for people that need support. However, this is not the right location. We need to stand.
So when we talk about compassion and having these centers to help our citizens, our children, our family members to get clean, that's what we should all want. And we all support that. But there's a better way to do it. And I believe what all of you are talking about right here is this. When you conduct a project management one-on-one is you do open and honest discussion before you start your project, so that you can solicit the feedback from the people who will be impacted by your product or your project. And so by getting that feedback, that inclusion from your citizens, that's what we're talking about. We have compassion. We support those who are suffering the tragedy of addiction. But we must work together as a community to find solutions.
A piece of her recovery was a one-year time where she was on the methadone program. She had to go to Capitol Hill to get it. It was not a perfect answer, but she would tell you that it saved her life. And there just is a time that they need to be on methadone, and it is a helpful thing. And I experienced taking her to the Methadone Clinic on Capitol Hill. She showed up, she got her line, she got her dose, she left. It was just a very quick process. She did have to get counseling there, she did have to get drug treatment there, but the most part of her experience there, and the experience of most people in a methadone clinic, is the showing up, getting their dose, and leaving. So I just want to add that to what you're thinking about as you're considering the fear of having this in your neighborhood. Up until a couple months ago, my grandson was at the Boys and Girls Club. I would have no problem, as a mom who's experienced having addicted people in her life, I would have no problem with this clinic being this close to him. And I understand your anger about feeling like this just has been foisted on you, and the fear, and it seems like it's an injustice. But I would just appeal to your heart, to your compassion. There really is no way to protect your children from addiction. It's all around us. We have to be part of a solution, even though it's an imperfect part of a solution.
Okay, go ahead. Coming from a law enforcement background, I'm a retired police officer from the state of California. I know what these clinics and the type of people in need of, obviously a lot of them, but a lot of them also are way far gone with no supportive system. I could see them going to a hospital type facility or an hospital zoned clinic area, but not where the foot traffic is going past a Boys and Girls Club facility with children, not through the neighborhoods and not accessing the bus lines into private area. And I just think that there's a better location, and there should have been more transparency to the residents of Lynnwood.
We were talking about alternatives. Were there any streets, roads, or in fact even comparable organizations to Arcadia that could take on the burden, even if it wasn't Lynnwood itself?
Well, obviously, we're not protesting having treatment centers. We're protesting about having it at this location. There's a pediatric facility in here, and there's the ball fields right there. There's kids all around this neighborhood. This neighborhood is not conducive. But the weirdest part about this is the whole process of waiting the last minute. This project was started back in March, and to wait till the 19th to inform the city council, wait till the 29th to have some minimal public input and say we're opening it within 30 days. That's not the way you do things. That's not right. If it was such a straight up great project, then why are they using these last minute tactics like that to basically try to deceive the public or not keep them not engaged till the last minute? But you can see that people are very upset. It's backfiring on them big time.
I'm sure that they're doing due diligence on Acadia Health. Acadia Health has been, as you said, running a treatment center in Bothell. So they do have a history here in the state of Washington. They have other treatment centers. So I'm sure that those are the things that are being taken into account with the Department of Health to make their final decision. So that's what they have to do. Like I said, it doesn't matter what health treatment it is, the Department of Health, if it's going on dialysis treatment, they would be doing their due diligence on the history of the company that wants to do dialysis. If it's medically assisted treatment for substance use disorder, they do the same thing. So they're doing their due diligence in that history.
How are they doing it? We repeatedly ask for more transparency, and they are not giving it, right? They don't even talk to us. That's the thing, right? Like, how are they doing their due diligence? We repeatedly email them about what we found about Acadia, even with their own Washington State clinic, right? People are saying, okay, you know, Acadia is a big company, maybe the other state is all local branch, local, we get that. But even for this Bothell location, this regional director, they have been proved again and again that they lied. They lied in their community relations plan. They lied. They don't know that in the meeting they actually referred to one of the police officers as a male, where actually that person is a female. Like, complete lie. And the Department of Health know this. Why are they not immediately say, okay, because of the lies and the incomplete document?
I can't speak for the Department of Health. That it, certainly as a legislator, that's.
But there is something you can do to help.
Lynnwood
City Council already drafted a letter to the state opposing and raising all these concerns, and that's what we're asking you to do the same. Why not representative people raise the concerns? Why else do you supportive of the thing, even though you acknowledge that so many wrongdoings in the process? I just don't understand. There's something you can do here.
Not provide your support so many times. So easy for you to see. And I want to ask, this including all the keyboard warriors, including state officials, what are you going to do if one kid gets harmed?
Exactly.
If homeless people come out here, are you going to come here and take them home? Are you going to come here and clean up the trash? You're not.
Yep.
And people talk about, I don't want to help. This past week, I personally drove to 3 methadone clinics. I sat outside in the parking lot. I look at these people because I want to understand. I do see that they come in and go. Many of them need help. And that's what we have repeated again and again. We want to help. But I also want to emphasize that there's a distinct group in this population that is very harmful to kids. And that's just fact. For anyone who disagree, I encourage you to just sit outside in the parking lot of the clinics and try to see with your own eyes.
Why you waited last Is that normal to do it that way? No, it's not. If it was such a straight up Wednesday.
Can you actually send it to me?
Yeah, send that to me. I want to get that too. You send it to me.
Yeah, I'll send it to you.
So the conversation started. This was the trash that he dumped all over our road. So when he had a truck parked right here with a trailer covered in trash, and it was a stolen vehicle. God. My neighbor recognized that it was a stolen vehicle because he ran the VIN, wanted to see whose it was. When he called it in stolen, a guy calls out from the trailer, tries to jump in the truck and run away. Sheriff's department pulled up at the same time. So the first thing I saw was the cop holding the gun on him right in front of my house.
That's right here?
That's right, yeah.
Exactly. Another example of why we don't want this here.
Yeah, absolutely.
You have addicts living amongst you that don't have the support they need. And they never will until you grow some empathy and flex that shit. Treat humans like humans. If you have a problem with profit in healthcare, go fight for universal healthcare. You backward, NIMBY bastards.
Anywhere where it's already about to be built. No, I don't have this area. But again, I don't know. It's not. I think it's fine with it being in evidence, but it's almost done here. It's already through the process. I don't care. The whole reason everybody is here is because you'd rather not have opioid clinics in your backyard.
You're not against people getting...
Dude, that lady literally said, not in my backyard.
Children.
There are children everywhere.
They don't congregate near boys and girls.
It's the first day of the year of rabbit. So we are here for a good cause. On the first day of the Lunar New Year, I urge Acadia, do things right. Start from the beginning. Department of Health, state officials, you admit there's a problem, fix it. Let Acadia bear the responsibilities. Let them bear the consequences, not their community, not their residents, not their people.